Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up. Your voice sounds kind of good. What's up?
This is my Lauren Bacall personality because I've been having some allergies, and I decided, I'll just be Lauren for a few days, right?
I like it. It sounds cool to me.
I thought you would.
So we're going to go to hopefully get some callers in here today.
Let's do it.
The phone number to the studio, if you want to talk to me or Nita, or both of us, is 866-870-5752. 866-870-5752. So hopefully you'll give us a call right now and get us all excited about what's going on with your body, with your musculoskeletal, your orthopedic pain. Wow, I got a little tickle in my throat.
Maybe you have allergies also. But our number is 866-870-5752, right here in the studio, 866-870-5752.
And what do they get, Nita?
They get a free book. You get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the foreword is written by the lovely Suzanne Summers, and you're in her latest book, too, by the way. And you get that for free. You don't even pay postage. So give us a call.
What a deal.
It's a deal, right?
Yeah. And I'm holding the book in my hand. It's got 200 pages or so of studies, which is all about how regenerative medicine works. That means instead of cutting tissue out and going through a surgery, what we do is we grow tissue back. So these are all studies in the back, and I think there's about 250 studies, right? Something like that, 260 studies. And studies are actually peer-reviewed. They go through committees to make sure that they're cool and they're real. And what we find out is that regenerative medicine is real, using platelets, using stem cells to regrow tissue. What we do is we stimulate new tissue to grow back. So if you have a meniscal tear in your knee, a rotator cuff in your shoulder, a labral tear in your hip, all of these different syndromes, anything from headaches, not all headaches, there's the musculoskeletal type headaches I can help with. And actually I have a question right now, Nita, if you don't mind if I take it.
Oh, let's do it, yeah.
It says tension and migraine headache. And this question came in from my website, which is www.lastemcells.com. That's www.lastemcells.com. Every single page on my website, and it's a very prolific site. It's got many articles, all the new research on stem cells and platelets. And every page has a spot where you can email me. I'd rather you call me and talk to me live right now. It's more fun. But I do answer questions all day and all night that come in from all over the world. So this one says, let's see, desperate to find a solution for daily headaches. That's awful. I get both tension and migraines, but the tension headaches are daily. So here's the thing with headaches. No one really knows what type of a headache they have because it's sort of a mixed brew. And some of them look like other types. But there are many that come from the back of the head or from the neck or from the actual upper back around the trapezius muscles and the levator scapular muscles, the rhomboid muscles. So what I do when someone comes in with headaches is I actually press on these areas. I examine these areas on the back of the head and down lower to see if there's any trigger points that radiate up into the head. And the most dramatic story I have was a man who came in with a constant headache. He said it was like a hot poker in his eye. He called it a migraine, okay? And this was when I first learned that migraines aren't necessarily migraines. And I said, do you mind if I touch the back of your head and your neck and all? And he goes, well, why would you want to? I have migraine headaches. And I said, just let me do it, okay? He said, okay. So I touched a spot on the back of his neck, and he jumped, and he said, don't do that. That hurts my eye. So I learned right on the job, right there. And I learn every day. I learn new things every day. And I said, do you mind if I inject that spot? And he goes, well, why would you want to? And I said, I think it's a trigger point. Trigger points are, they're defined as ragged red fibers, but what the reality of it is, they're areas where you have pain that radiates somewhere else. And in acupuncture, they may call them meridians or acupuncture points. Anyway, he let me inject with some lidocaine, which is just a local anesthetic. And in about 10 seconds, he said, my eye pain, my headache is gone. So I learned a good lesson.
Wow.
Yeah, it was, and I've had so many other people over the years. I've been doing this over 25 years. And I can't get rid of all headaches, so don't think I can. But there are some which are really more trigger points that radiate from the back of the head, the neck, and the upper back, where we can just inject it. And often it'll have to be an injection with, the lidocaine can work for a short period of time because it only has a half-life of a couple of hours. But we'll often inject the areas which are entheses, where the muscle is attached to bone, with platelets from the blood, PRP we call it, platelet-rich plasma, and or stem cells, and heal the areas so that the headaches can actually go away. And with that, oftentimes people have neck pain, and the neck pain goes away too. And a lot of times I'll inject along the occiput, which is the lower back of the head, and the muscles there can be tight and can have problems with this certain nerve, greater auricular nerve up there, and other things that can be injected to get rid of headaches. But again, there's a lot of headaches that are from other sources. They can be from drinking wine or beer or eating chocolate. Not you, right, Nita? You love chocolate.
I love chocolate.
Me too. And you know what? Chocolate is very rich in antioxidants, and the best type is the type that is very, very dark with very little sugar in it. Flavonoids, antioxidants.
So it's actually medicinal.
It is, but don't eat the kinds that have a lot of sugar in it, because we know that sugar is the big killer and the root of many, many, many diseases. Do you remember recently our good friend David Crosby died, right?
Yes.
Poor guy. I mean, he was 81, but full of life, and he had just done like 4 new albums at that age. Nothing was stopping him. But I think he died from they said type 2 diabetes, but to me that's just overeating carbohydrates. He had a big tummy, and people get into the rut of their addictions, and one of them is that dopamine rush that we get from eating carbohydrates. It turns into sugar, and we have to be very careful. Being skinny is the answer to good health, and the only studies we know about that increase age, I know the ones that were done at UCLA, and if you've got type 2 diabetes and you get off of the carbs, you actually live about 8 to 10 years longer. So that's anti-aging. So it's very cool. All right, I'm going to give out the phone number. If you want to give me a call, I'd love to talk to you about your musculoskeletal issues. Anything that you're thinking of getting a surgery, talk to me first, because most people that come to me ready for a surgery don't end up doing it. Some do. It's always a choice when it's elective. Elective means you have the choice. It means your surgeon doesn't say we have to do that. It means he says it's really your choice. So most surgeries are elective. There are many that are emergencies, and God bless you, go get those done right away. Don't come to me for those. But then there's a question of what is an emergency. And a lot of times, people come in with a numb arm or leg from a nerve impingement, and we can still sometimes help those. But sometimes it could be, let's say, a herniated disc in the neck or back that's slammed down on a nerve, and sometimes surgery is necessary for that. Most of the time it's not, and some of these surgeries fail, and that's the big problem with surgery. I would be doing orthopedic surgery right now, except that I had one on my shoulder that failed while I was in fourth year med school, and let me know that even though I was I will say the word addicted to doing surgeries, because it was a lot of fun in my training and I loved it. But after I had that surgery on my shoulder, which I find out later never should have been done, and I was able to heal it with regenerative medicine myself. I injected my own shoulder and healed it basically overnight. And I realized that surgery is not the answer for everyone. If you want to do it, you should do it. I'm not going to tell you you don't have to. It's always a choice. I have another question here. I'm going to give out the phone number first in case you want to call and talk to me live. And the phone number to the studio is 866-870-5752. If you'd like to call the office and get more information, the number to my office is 800-300-9300. We have people at the phones. If we're busy, just leave your number. We'll get right back to you. It's 800-300-9300 at the office. And if you want to just email me through the website, it's www.lastemcells.com. So the next question is post-ACL issues. Let me read this one. I had an ACL rupture several months ago, had an ACL repair, and the pain is still there, and my knee is still loose. That's interesting. So that surgery failed, and I am filled with patients who have had failed surgeries. And I know we go into surgeries believing it's going to help us, and unfortunately I'd say about half of them fail. There's another half that seem to do good, and then sometimes they fail down the road. So I take care of ACL ruptures all the time. The ACL is the anterior cruciate ligament. It's the ligament that keeps the tibia, the lower leg bone, from sliding forward from the femur, the upper, the thigh bone. And the first thing I do, I look with my ultrasound inside the knee, and if there's a lot of fluid in it, I'll drain it out. And if you had an ACL rupture, or you think you did, or your knee is swollen, the first thing to do is get that fluid out of there. If it turns out that it's blood, red fluid, that can turn into a big blood clot, and then the healing is real slow. The studies show if you have an ACL repair and you want a surgery, if you want to get it repaired, if you have the rupture of it, the best time to do it is about 3 months at least after the incident, after the trauma that caused it, not right away. So there's no rush to get a surgery if you have an ACL rupture. Unfortunately, with all the sports teams, it's very in vogue to have surgeries. And I've had to talk my children out of it many, many times. They're very avid athletes. And when they get an injury, they're like, I got to go get surgery, Dad. All the other kids have had it. And I go, don't do it. And then we'll do regenerative medicine on them. They get better. And they're kicking and screaming because it's not cool not to have a surgery. I know that sounds crazy. But that's the way it goes with these high school and college teams. There's just a lot of surgeries going on that never should have been done. I get a lot of these kids after their surgeries where it fails, and then we use regenerative medicine to help them heal. So let me see what else. I got a plantar fasciitis question, but let me give out the phone number, and you can talk to me right now. We'll give you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got about 260 studies on how surgery is not the greatest thing in the world to help you heal, and how regenerative medicine can do it very easily. When you do regenerative medicine, you walk into the office, you get injected, and you walk out. You can drive home all by yourself. It's very, very conservative. It's very simple. Surgery is not conservative. and many people have many side effects afterwards. I've had a couple patients die, one during surgery, one after surgery. I hear stories about it all the time where people have terrible outcomes because it's very invasive. And the tide of orthopedics is changing. A lot of orthopedic surgeons are now learning how to do PRP and stem cells, but it's going slow. Medicine's hard to change. And when you get into these areas that are not what we'll call traditional, and traditional today is doing surgery and giving medication. When you're outside that box, a lot of doctors don't want to refer to you. Thank goodness I'm finally, after 25 years of doing this, getting referrals from other doctors. It used to be pretty much just from the patients who would refer their family and friends. But now finally, medical doctors are getting smart and starting to use regenerative medicine and sending their patients to me. A lot of chiropractors refer their patients to me too. When they are at a dead end with their patients, they'll refer them to me. A very good one that I like is Randy Weinzoff, who's in Santa Monica, and I send him a lot of my patients that are dead end for me. So if someone has, let's say, low back pain, I can help usually heal that. But often if they have a radiculopathy or leg pain, I'll send it to Randy, and he can straighten out the spine often and get that radicular pain down the limb to release itself. So we almost have a caller here. I'm waiting for a name.
So let's give the phone number again. How about the website? Did you give the website?
I will do it.
Okay.
It's Andy just popped up here. Let me go to him.
Okay.
Hey, Andy, Dr. Marc Darrow, how are you today?
Hello, doctor. Hello.
Yeah, I'm with you, buddy. You've got a ring finger issue. What's a ring finger issue? What does that mean?
Well, my ring finger has what they call Dupuytren's, I think the way you pronounce it, Dupuytren's constricture, where the finger won't straighten out.
Yes. And you want to know how to fix it?
I didn't know if your treatments, the prolotherapy or the PRP or whatever would be of a help to that type of thing.
Well, there's many issues involved with that, and like anyone else, I have to examine them before I can tell them if my treatments of regenerative medicine would work. Do you have a cord in your palm, like a thick cord that you can? Okay, so there are guys who do my work that do that. I don't. The best place to go for that is a hand surgeon. There's a guy I love at UCLA named Prosper Benham, Benham, and he's a master at that. And what they often will do is just inject you with, I think it's called Xyloflex or Xyloflam, something like that, which is an enzyme. It's just a couple little injections in that tense cord, and it loosens it up, and then they can loosen up the finger. I don't know if you've gone to a hand surgeon yet. Have you?
I haven't been to a hand surgeon, no.
Well, that's the guy that I would go to, and that's what I would do for it. There are things, like I say, that regenerative medicine docs do for that, but I think the best way is to go to a hand surgeon for that, Andy. Do you have anything else in your body that hurts you?
No, I seem to be pretty good shape, fortunately.
Excellent. Excellent.
But I appreciate your advice on that.
Yeah, it's my pleasure.
Can I call your office to get to? I didn't have a...
Yeah, the phone number to the office is 800-300-9300.
Okay, and they would have that doctor's name and information?
No, I'll give it to you again. It's Prosper, like if you prosper in the world. And his last name is Benham, Benham. He's at UCLA in the hand surgery department. The nicest guy. He's done surgery on many of my patients that I've referred to him, and they've all had excellent results. Trigger fingers, Dupuytren's, you name it.
Okay. Well, thank you so much for your advice and help. I appreciate your program. I've listened to you a number of years.
Oh, thank you so much. I appreciate that.
and my wife has got after me to say, call Dr. Darrow and see what he has to say.
Well, I'm always happy to help people out, even if it's something I don't do. I refer people to all types of doctors that I think are really good.
Okay. Well, thank you, Doctor. Appreciate it.
I appreciate you, too, and I appreciate the call.
The number is
866-870-5752. If you want to talk to me live right now, you have questions about your musculoskeletal system, anything from the head all the way to the neck and back, and the limbs, the elbows, the shoulders, the fingers, arthritis, plantar fasciitis on the bottom of the foot, you name it. It's things that I inject and usually can help heal if I pick the right patient. What I do isn't going to work. Platelets and stem cells don't work on everybody for many reasons. And one of the most common reasons for failure is that the patients stay too active. And I had a guy who plays pickleball, and he came in with a shoulder injury from pickleball. And I injected his shoulder once with platelets and stem cells. He came back 2 weeks later. He said it didn't work. And I said, I bet you played pickleball. And he goes, well, I only played 3 times.
Oh, my goodness.
And I said, you know what? You signed something saying that you're going to call me before you exercise it. Do you remember that? He goes, yeah, but I'm addicted to pickleball, and I had to do it.
Oh, no.
So he came, he was there. We redid it, and he came back 2 weeks after that, and his shoulder was better. So overactivity doesn't help things heal after you're getting regenerative medicine. You got to chill. One of the other reasons is taking anti-inflammatory medicines like ibuprofen. That actually blocks the healing and blocks the regeneration of tissue. And a lot of docs do not use ultrasound to guide the needles for the knees and the hips and the shoulders where it needs to be used. And doing blind injections without an ultrasound does not put the needle where it belongs. Years ago, all of us regenerative medicine docs wondered why we didn't heal hips very well, because hips are deep and the needle didn't go to the right place. We were doing blind injections. Now that we use the ultrasound, the hips heal as easily as anywhere around the body. We're going to go to Marv. Hi, Marv. We're going to talk about your lower discs, offset causing pain. So do you have herniated discs?
Yes, I do. I had an accident back when I was 9 years old. I'm 72 years old. And I've done all the sports and everything else and never seemed to have a problem. But recently, in the last couple of years, I've had like a sciatic right hip nerve really acting up. And I know I have 2 lower discs that are displaced. I've seen the x-rays.
Okay.
And so that's from an injury back when I was 9, like I said.
And all these years you've been able to do sports?
Yes. I've been very active my entire life, but now it's difficult to stand up for any period of time. And in the mornings when I get up, I usually get up around 2 o'clock in the morning. I'm a truck driver, so everything is stiff and sore, and once I get going, then things seem to be okay.
All right, so that's good news, and that's that information alone makes me think I may be able to help you. The fact that once you loosen up, the thing goes away. The main thing for you that we're not going to be able to know about is exactly where the pain is being generated from by what you're telling me. It's definitely not necessarily caused by discs that are bulging. That's number one. If you have bulging discs, hang with us, please, Marv. We're going to go to a break. And for those of you that want to call in, this is Dr. Marc Darrow. We're talking about regenerative medicine of platelets and stem cells. Number to the studio is 866-870-5752. Hang with us, Marv.
Absolutely. Thank you.
You're listening to Living Pain-Free with Dr. Marc Darrow. We'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.